And thank you very much to my friend from New Bedford for his words. I would like to close this debate with an open letter to the Mylan CEO, Heather Bresch. This was authored by a constituent of mine, Dr. Mark Kenton, who's an emergency room physician at Mercy Medical Center in Springfield. If my colleagues would be so patient, I think it merits reading the entire letter. We'll do it pretty quickly, but given the severity of this issue, I think this letter merits a reading for the chamber. It was an open letter to the Mylan CEO, Heather Bresch. It says, in light of recent news regarding EpiPens, I would like to give you an opportunity to justify your pay increase from $2,453,456 in 2007 to $18,931,068 in 2015. In that time, the wholesale sale cost of an EpiPen has gone from $56.64 to $317.82. By the way, the cost of a 1 millimeter amp of epinephrine is $4.49. So I give you the opportunity to justify the increase in the cost of an EpiPen as well as the increase in your salary. I know you must have an explanation. As a practicing emergency medicine physician, I have cared for nearly 50,000 patients in my career. As a team, my nursing staff, techs, medical assistants, physician's assistants are all trained to save lives. We frequently care for acute anaphylactic and allergic reactions. So while I know you must have an explanation to my question, here are some things I know you do not know. You do not know the look on a patient's face when they are struggling to breathe after a bee sting. You do not know the fear a patient has when their lips and tongues are so swollen there is barely an airway to care for. You have never heard the sound of a stridor when air can barely make its way to the lungs. You have never seen the look of a parent when their child is unresponsive. You have never had to debate whether you need to give epinephrine to a patient in an anaphylactic shock who has underlying cardiac disease with the knowledge that the drug may save their life but could cause a heart attack. You have never attempted to intubate a patient in respiratory failure after a bee sting. You have never watched your own child, while on vacation, eat a peanut butter sandwich, which they have done so many times before, but break out into a severe rash and receive a prescription for an EpiPen, only to be told that the pharmacy doesn't accept your insurance, and you have to pay $500 out of pocket for a potential life-saving medicine. You have never performed CPR on a child. You have never told a parent that their child is dead. These are things that you do not know. However, I do. I have done them. This is Dr. Kenton, not myself. We do. My team has done them. So please, Ms. Bresch, justify your increase of 461% for a medication that costs $4.49, to the point that patients and families who may not have insurance have to make a decision that could lead to their child's death. Justify your pay increase of 671%. Justify your greed. This is sincerely Mark A. Kenton, DO of Mercy Medical Center in Springfield. Madam President, in honor of Dr. Kenton, in honor of the men and women every single day who work to protect our children, in honor of the 10,000 school children who use EpiPens every single day and rely on them in our schools in the Commonwealth, I ask that when this vote is recorded, it is done so with a tallying of the yeas and the nays.